Thanks everyone for joining today. It was 2 years ago, on March 11th, when the World Health Organization first declared the COVID-19 outbreak to be a global pandemic. And so today we mark that anniversary with some relatively optimistic news for all of us. As of yesterday, over the course of the pandemic, we've reported 369,000 cases of COVID-19 in King County, over 11,000 hospitalizations, and 2,629 deaths from COVID-19 since February 2020. Over the last 7 days, we've seen an average of 226 cases reported each day. And this is down from a peak of 6,457 cases reported daily on January the 10th. And cases have declined in all age groups and in all areas of the county. Cases now are approximately at the same level they were last winter before the Omicron surge, about 3 to 4 times the level of cases that were reported last June and July, the summer before the Delta surge. The 7-day case incidence rate has fallen to 70 per 100,000. And this rate, along with our hospitalization rate and our hospital bed occupancy in King County hospitals, are evaluated to determine our COVID community level in the CDC's new classification. We can talk more about that. Our 7-day incidence rate is declining in all age groups, and it's currently slightly higher among younger people and younger adults compared to older adults. With respect to hospitalizations, new COVID-19 hospitalizations have sustained a downward trend over the past 2 months and are now comparable to the levels we saw just before the Omicron surge and just before the Delta surge last spring. The 7-day hospitalization rate in King County is 1.8 per 100,000 people. In the last 7 days, a total of 41 people were hospitalized for COVID-19 in King County, compared to 60 people per day at the peak of the Omicron surge in early January. Currently, 6 people are hospitalized each day, or someone hospitalized every 4 hours in King County. As the number of new cases decline, our healthcare partners are reporting that hospital capacity is improving, with just under 5% of staffed inpatient beds occupied with COVID-19 patients, compared to 21% of beds occupied at the peak of the Omicron surge. And this is comparable to the number of staffed beds that were occupied with COVID-19 cases just before Omicron surge, and a bit higher than that was seen last summer before the Delta surge. At this time, hospitals are beginning to treat their large backlog of patients whose procedures and surgeries were delayed when hospitals were overloaded during the Omicron outbreak. Ongoing staffing concerns and high volumes of patients continue to challenge our healthcare system, however. And unvaccinated people are about 13 times more likely to be hospitalized compared to someone who is vaccinated and boosted. So our unvaccinated residents continue to represent a disproportionate number of those who require hospitalization. Our daily COVID-19 deaths have also decreased by 55% from an average of 9 daily deaths in early February to 4 daily deaths recently. And unvaccinated people are 24 times more likely to die from COVID-19 than people who are vaccinated and boosted. So let me just pause for a second, talk about how we're determining our community COVID-19 level according to CDC's new classification. As I mentioned, King County's 7-day case incidence or transmission rate is 70 per 100,000 per day, 70 per 100,000 per 7 days, compared to the CDC threshold of 200 cases per 100,000 per 7 days that defines low versus moderate. King County's hospitalization rate is 1.8 per 100,000 over 7 days, compared with the CDC low-level threshold of less than 10 per 100,000 over 7 days. And our hospital staffed bed occupancy rate is about 5% compared to the CDC low-level threshold cutoff of under 10%. So our numbers place us in the low community level, well below the cutoffs for medium or high level. And at this level, CDC does not recommend universal indoor masking, but does recommend vaccination, enhancing ventilation, COVID-19 testing, isolation, quarantine, and that immunocompromised persons have a plan with their healthcare provider for rapid testing and treatment if necessary. Now, with respect to our vaccines, we continue to track the relative risk of COVID-19 illness, hospitalization, and death based on vaccination status. And we've added booster status to this data available on our online vaccination status dashboard. With 85% of eligible people in the county having completed their primary vaccination series, and with the more infectious Omicron variant, we saw more people getting infected who were vaccinated as well. But this does not mean that the vaccines are not working. Although vaccination does not always prevent infection, it does provide measurable protection, with unvaccinated people being about 2.5 times more likely to be infected with Omicron than people who are vaccinated and boosted. So it's not 100%, but it is 2.5 times more likely that you will be infected if you're unvaccinated compared to someone who's vaccinated and boosted. Vaccination also decreases the risk that someone will spread the infection to others. But the primary value of vaccination is in preventing serious infections leading to hospitalization and death. And compared with people who are vaccinated and boosted, unvaccinated people are about 12.5 times more likely to be hospitalized and 24 times more likely to die from COVID-19 in the past 30 days. It's really important to understand how critical the booster dose is here, though, when we talk about protection against hospitalization and death. And it's important to get that dose when you're eligible, because people who have completed their primary series but have not gotten their booster dose are more likely to be hospitalized or die compared to people who've been boosted. So for the best protection, please get your booster as soon as you're eligible. Now I'll talk a bit about lifting our mask mandate. Given that the statewide and local indoor mask mandates will be lifting at the end of the day today, I wanted to briefly review our situation in the context of these lifting mandates and remind everyone that this does not mean that the COVID-19 pandemic is over. It does not mean that COVID-19 is no longer a problem. And it remains very reasonable for individuals to make the choice to continue to mask in indoor settings based on their personal risk assessment and preferences. The risk of acquiring COVID-19 today in King County, especially the risk of acquiring severe infection, is greatly reduced compared to earlier in the pandemic, thanks to the high levels of vaccine uptake by King County residents. And again, I want to thank everyone who's been vaccinated, because this is how we protect ourselves and our community. 93% of eligible King County residents have initiated their COVID-19 vaccination series, and 85% have completed it, while over 80% of those who are 65 years and older, and about 2/3 of those who are between 50 and 64 years have received their booster, which provides them with the highest level of protection. COVID-19 cases and hospitalizations are no longer at high levels and continue to decrease, and our healthcare system is no longer near surge crisis levels. In addition to protection from vaccination, the large number of adults and children that were infected during the Omicron surge will likely provide some additional community immunity for at least the near future. But COVID-19 is still circulating, and some risk remains, especially for people with weakened immune systems from disease or medications, people with certain underlying health conditions that place them at increased risk for severe disease, advanced age, and those who are unvaccinated and unboosted. So for this reason, the use of high quality, well-fitting masks still makes sense for certain people, particularly in crowded indoor settings with poor ventilation. And it's very reasonable to continue to wear a mask in indoor public spaces if you are at increased risk for severe disease, if you're unvaccinated, or if you're in contact with someone who's at high risk. In addition, some people may choose to wear a mask in public settings out of consideration for those other people who are at high risk, or if they further want to reduce their own risk for any reason. Layered COVID-19 protections continue to be important, and this includes staying up to date on vaccination and boosters, improving indoor air quality through ventilation and filtration, and for high-risk people especially, masking and considering limiting time in crowded and poorly ventilated indoor spaces. And please don't throw away your high-quality, well-fitting mask, even if you're not using it today, because it will be useful again in the event of future COVID-19 surges, which remain a real possibility. Now, as part of lifting the statewide indoor mask mandate, Washington State Department of Health released updated guidance for schools and childcare this week. And under this guidance, masks are optional in most indoor settings in schools and childcare facilities. And King County is aligning with the Washington State guidance for several reasons. As I mentioned, community transmission rates in King County have decreased substantially and are continuing to fall. And as I noted earlier, the recent Omicron surge likely has resulted in some additional immunity, at least for the short term, among the many school-aged children who were infected. In addition, regional school administrators and our neighboring health jurisdictions strongly desired a consistent approach to official masking guidance across counties and the flexibility to tailor school mask policy at the district level to reflect the values and risk tolerance of their individual school communities. So even though the mask mandate is ending, school districts and childcare facilities may choose to require masks for students, teachers, and visitors. And any individual who chooses to continue wearing a mask in school or childcare should be supported in their decision. Many families, students, and school staff are now working through making their own decisions about when and where to mask based on their own personal risk profiles and risk tolerance. The American Academy of Pediatrics has published new guidance listing factors for families to consider in deciding whether they should continue wearing masks in indoor settings. And we've recently published a blog on our Public Health Insider site that provides additional considerations for families as they make these decisions. Now, as we move into the next phase of coexistence with COVID-19, we need to prioritize system-level strategies that will reduce the risk of disease over the long term, including in the case of future surges. And this means improving indoor air quality through ventilation and filtration. And we've developed guidance on how to improve indoor air ventilation and filtration, which I encourage everyone to review. And this includes guidance for home and business locations, and we'll insert the link in the chat. Our environmental health staff have been conducting education and outreach and technical assistance to help schools, childcare centers, and small businesses improve indoor air quality. And we're working with school districts to offer free in-person ventilation assessments to all schools and childcare facilities in King County. To date, our teams have conducted in-person assessments with over 100 schools and childcare facilities and provided over 2,000 free HEPA air cleaners to schools and childcares. We're partnering with community groups to provide free ventilation webinars and technical assistance to small businesses and organizations, and have done over 700 consultations to date. Public Health has also distributed over 6,000 HEPA air filters at no cost to homeless service sites, schools, childcares, faith-based organizations, and small businesses. And we've given over 600 box fan filter kits to households with vulnerable populations. I'm very much looking forward to new guidance from the Environmental Protection Agency, as well as new indoor air quality standards, which I hope will be available as soon as possible. It's critical to take advantage of this lull in COVID-19 activity to improve our preparedness for future surges. And I encourage everyone to do what you can to make improvements wherever possible to indoor ventilation in your homes, your businesses, and other public spaces. I want to pivot to vaccinations for a couple of seconds. Our vaccination work continues, and each day more people choose to get vaccinated and boosted. As I mentioned, 85% of King County residents who are eligible, who are in the age 5 years and older, have completed their vaccination series, their primary series. 93% have initiated their vaccination series, and that is outstanding. We still have some more work to do on vaccinating children. Just over half of our 5 to 11-year-olds have now completed the primary series, and almost 60% have started their series. And over 80% of our 12 to 17-year-olds have started the vaccination series, and about 3/4 are fully vaccinated. So this is really great news, and we're making progress and have more progress that we can make in the coming months. In terms of boosters, over 1 million booster shots and third doses have been administered in the county. And as I mentioned before, this is so critical to our community's health and keeping people out of the hospital and limiting the number of deaths. The booster is essential. We have 84% of those 65 years and older who have been boosted. And that is one of the most important things in limiting the number of hospitalizations and deaths in the county. Also, about 2/3 of those who are between 50 and 64 years of age have been boosted. And we encourage anyone who has not yet received their booster dose to please get it as soon as possible. The rates of booster coverage among younger people are lower than they are among the older adults. And vaccination and boosters remain free of charge to people who get vaccinated. And there are many sites where you can get a shot right now without an appointment. So with that, I'll pause and welcome a discussion with you about where we're at in today's outbreak and where we're headed.
Thank you so much, Dr. Duchin. As a reminder for media, if you'd like to ask a question of Dr. Duchin, please use the raise your hand function in Zoom. And first question is from Matt Markovich.
Dr. Duchin, I actually have 2 questions, if you can hear me.
Yes.
The first off is, can you explain going forward the testing sites and the COVID vaccination sites? Are you going to keep them in the same hours, the same, everything's going to be the same, or are you going to be scaling back in the future?
Okay. Yeah, we are pivoting our approach with respect to testing as the testing demand continues to decline. At our free testing sites, we still recommend making an appointment. You can get appointments, but to avoid wait times, we do recommend making appointments. We're still performing large numbers of tests at our sites, and we're continuing to distribute at-home tests throughout the county, and the state and the federal government are also doing that. But we are also pivoting our testing strategy from and our vaccination strategy, both from some of the large volume sites to more targeted approaches. So we'll have more information shortly about what's the changes will be in the hours and locations. But right now, you can still go to kingcounty.gov/COVID/sites to find the testing sites near you.
Is that something next week, next month?
Yeah, I can't give you an exact date, but we can try and get back to you with one. We'll have to consult with our testing team and try and get a date. I don't know offhand, top of my head, when that's going to be announced.
And my other question regards the CDC risk assessment guidelines, the green, yellow, and orange chart. As people go forward and this is becoming more prevalent to look at what counties where they sit, is King County going to adopt that green, yellow, and orange kind of matrix to kind of easily suggest where we sit in the situation in regards to the CDC guidelines? Do you like that idea? What's your interpretation of that?
Yeah, so I think providing standardized metrics and a system for classifying COVID-19 activity is critical for a coordinated national response. And so we're all on the same page about what measurements we're using and what we do in response to certain levels. And I really appreciate that CDC has now provided a rationale for these community levels, and they're really focusing on the impact of COVID-19 in the community. And in particular, they're looking at hospitalizations as a reflection of that impact. You may remember that their previous scheme had different breakdown of what they call transmission levels, which also ranged from red to yellow to orange to green. And those levels were empirical. They weren't linked to any particular metrics, and there was no published rationale for them. And many people are now saying, well, these new metrics are different than the old ones, and that's true. But I think it's important to remember that the old ones really weren't based on any rationale similar to the one that the new system is based on, that tries to get at community level impact of cases, not just count cases, but what do those cases mean? And over time, the significance of a case has changed a bit in that, the variants have changed. The Omicron, we know, is less likely to cause severe illness, hospitalization, and death. Reinfections and infections in vaccinated people are still cases, but they're less likely to be as impactful as cases in unvaccinated people that we saw earlier in the outbreak, and so on. So they're both categorization schemes, but the new scheme, in contrast to the old one, actually has a rationale for how they arrived at it, and they have thresholds that they've established that break us down into high, moderate, and low levels. And each of those
are those thresholds too high for you?
Right. Yeah, I'm getting there. So sorry, I'm just really long-winded as usual.
Okay.
So whether these thresholds are optimal for either de-escalating or implementing mitigation strategies, I think remains to be seen. I am a little bit concerned about what seems to be a high hospitalization threshold for triggering implementation of community measures like masking. I think a 7-day new hospitalization rate of between 10 and 20 per 100,000 is a bit high to trigger your first community-wide mitigation measures. And for the reason I say that is, a hospitalization rate of 10 per 100,000 per week is equivalent to the highest weekly hospitalization rate that we've seen over the past 12 flu seasons. And we know that at a hospitalization rate of 5 to 10, our hospitals are very stressed. So I am a little concerned about that threshold being too high. And, as a trigger, waiting for this level of hospitalizations to implement measures to interrupt COVID transmission may be a bit late to avoid a subsequent major surge and to avoid as many cases and infections, hospitalizations as could be with earlier action. And I'm hoping that there'll be some additional modeling done that can help us explore and inform optimal metrics and the timing to trigger those mitigation measures under a variety of scenarios. And those scenarios relate to the transmissibility of the virus, the virulence of the virus, the immune protection from past infection and vaccination, and so on. So I would say the jury's out on whether those are the optimal metrics, but I applaud CDC for putting out metrics, for standardizing the approach, for putting out their rationale. And maybe we will be able to improve upon what they've proposed. I think, considering the rate of rise of transmission and the rate of rise in hospitalizations, and also considering data from other areas that may be experiencing surges before our community, may also allow us to take earlier action and improve prevention opportunities here. There are some issues. I also think that long COVID, cases are important in the context of long COVID. Long COVID can occur and frequently occurs in patients who don't require hospitalization, who have relatively uncomplicated initial COVID infections. And so we need to learn more about long COVID, and that can also help us inform the relative importance of preventing transmission that does not result in hospitalization. So hopefully that got at your issues.
Thank you.
Great, thank you so much. Next question is from Elise Takahama with Seattle Times.
Hi, Dr. Duchin. Thanks so much for doing this morning. You mentioned the need for continued layered protections, especially vaccines and boosters now that mask mandates are lifting. So could you give any guidance for people who are feeling like there's been a little bit of mixed messaging, particularly now that the county has also ended the vaccine verification requirements?
I'm not exactly sure what you're asking for. Sorry, Elise.
Oh, sure. Yeah, I can rephrase a little bit. So basically, with mask mandates lifting and a lot of restaurants and businesses no longer required to check people's vaccine status, we've just been hearing from some people who are concerned about that, especially because public health officials are continuing to say that we need to stick to our layered protections and especially with vaccines and boosters.
Right. So I think, that as the pandemic evolves, the strategies that we use as a community, as government, and as individuals also has to evolve and change. And we have very high vaccination coverage in King County, and we have done very well with respect to other communities throughout the nation in limiting hospitalizations and deaths throughout the pandemic. And right now, we know that our vaccine verification requirement, for example, which was for 2 doses and not 3, and which was put in place during the Delta surge to help our healthcare system primarily get through that surge and to limit the number of cases and hospitalizations, has served its purpose. And continuing a 2-dose vaccine verification system at only some places in the community where people get exposed, it really was not going to meaningfully impact population level disease, especially as we're in the waning stage of the Omicron surge. We've had lots of people infected with some immunity, and we've got very high vaccination coverage rates in general. We also know that even with 2 doses, it's possible to be infected with Omicron. And so it wasn't, once Omicron appeared, the policy wasn't as effective as it was designed to be during the Delta surge, where protection against infection was higher. So that all that is just to say that vaccination still remains critically important, and boosters remain critically important. And the fact that we don't have a requirement for 2-dose vaccination in certain venues anymore should not give anybody the impression that vaccination is not important. It's one of the main reasons why our community is doing well, and we're going to need to continue to have high vaccination coverage and booster coverage for those who are eligible to protect our community members and ourselves as much as possible. With respect to the masking guidance, I understand why people feel uncertain and confused about, again, the shift in guidance and the CDC criteria being different than the old criteria. And again, I think this is a recognition of how the pandemic is evolving in the US and here locally, with here in particular, falling hospitalization and case rates, high vaccination coverage rates. The risk to most people is relatively low compared to what it has been in the past, but it's not gone. And I'll speak more about this in a few minutes, but COVID-19 continues to circulate. So it's very reasonable for people to want to understand, what does that mean for me? And the way to understand that is to take into account, what is your own risk for severe illness? Are you vaccinated and boosted? And really don't downplay the importance of the booster dose. It's critical for full protection against, or the fullest protection you can get against hospitalization and death. So are you able to be vaccinated and boosted? And if you're an immunocompromised person, have you received all the doses that are recommended, the 4 doses? So everyone should be as vaccinated as they're eligible to be. That will help reduce risk. The other issues are, your own personal medical history that may impact how much risk you are at if you get infected, the type of your age, the others that you're in contact with who may be vulnerable. and your own risk tolerance. How much risk are you comfortable with? And this varies from person to person. Some people are very risk averse. Some people are very concerned, and I understand this, and I share this concern about the potential for long COVID, and therefore may want to take more steps to reduce their risk than people who are less concerned about long COVID. May not land you in the hospital, it may not kill you, but long COVID can be a very severe condition for some people. We don't really understand as much as we should or need to about long COVID, how common it is and how to treat it. So these are all factors that people can take into consideration when they decide if they feel like they need to continue to mask. And the other key consideration is, what activity are you talking about? Outdoors is a very safe. People should feel reassured that masking is likely not necessary in almost all outdoor conditions. Indoors, and particularly in crowded indoor spaces where you'll be spending a long time, or with activities that increase the risk for COVID transmission, like aerobic exercise and singing and so on, those situations also present a higher risk. So, you need to take into account your own personal vulnerability based on your medical condition, your desire not to potentially become infected because you might be exposing someone else who's vulnerable, your feelings about long COVID and the risk you want to take, and the importance of the activity, and whether or not mask wearing is a problem for you. For me, and I know for many others, I don't feel like it's a big deal to wear a mask. I have some really comfortable, high quality N95 respirators that cost me less than $1 each and that are widely available. I wear them multiple times. You can wear them until they basically are soiled or the straps don't work anymore. They seal really well on my face, and I feel that they provide a high level of protection. That I don't feel that that's a major inconvenience or a problem. And so, if I feel like I'm entering a situation where there's a personal risk, I don't feel like wearing a mask is a deterrent or something that is outweighs the benefit that mask provides. And those N95 respirators provide meaningful protection against infection. Other people feel differently about the mask, and they feel that it's really unpleasant, uncomfortable, and they don't want to wear them. They feel like they would rather accept the risk of COVID-19 in our community currently than wear a mask. And that's their personal, risk-benefit assessment. But everyone has a different approach in that context. And I think at this point in the pandemic, with numbers waning, continuing to go down every day, we can let people make their own decisions. And if we see something worrisome happening, if we see the rates of disease increasing, then we can try and understand what's happening and whether or not we need to do anything differently with respect to our recommendations around masking or other mitigation measures. But at this point, I think there's room for flexibility in how individuals approach masking in public. Did that answer your question?
Yes, thank you so much,
Okay.
Duchin.
All right, great.
Great, thanks so much. All right, next question is from Kate Walters with KUOW.
Hi, good morning, Dr. Duchin. Thank you again for doing this. You actually covered a little bit of my question in your response to Elise, but I'm wondering if I could ask you to get a bit more specific. I think some people are really clear about the decisions they will make once the indoor masking mandate lifts, and some people are still trying to work out how to do that. So you talked about risk factors that people should take into account, but could you talk a little bit about where you personally feel like you might be comfortable taking off your mask indoors and where you think you'll keep it on, whether that's something like the grocery store or another indoor setting that you frequent?
Yeah, so my individual or personal risk assessment is based on my own age, my health conditions, and the particular environment that I'm in. For instance, last week I was visiting my 94-year-old mother, and I was very careful around her. I tested myself every day before I saw her. And I also, improved the ventilation in her apartment, much to her dismay. I wore a mask in public at all times, but not when I was with her. We were unmasked together. And again, I was testing myself at that point. And testing provides a lot of reassurance, but it's not perfect. But we made the risk assessment together that we didn't want to be masked together. Currently, I will continue to mask in crowded indoor spaces. I don't really feel the downside of masking is very important for me personally. And I feel I would like to avoid even a non-serious COVID infection. I'm vaccinated and boosted, but I'm not interested in getting COVID, period. I would prefer to continue to be vaccinated if necessary and avoid getting infected. Now, there are people I know who, have been vaccinated and maybe have had infections as well, and they've got very robust immunity. They may make a different assessment. But for me personally, it really will depend on the activity that I'm engaged in. I go intermittently to a gym and I wear a mask indoors in the gym, and I'll continue to do that for the time being. But all of these risk assessments will change based on the location, the activity, the number of people involved. If there's crowding, I'm more likely to want a mask. If I'm getting together, I have two children, both of which work in healthcare in one way or another. They're exposed to patients in their work. They're exposed to other employees, but I gather with them without masking in our household. So it depends on the individual setting, who's there, the number of people that are there, the ventilation and air quality status of that setting are really important to me as well. If it's a well-ventilated large space, I don't feel as worried as I would in a small, poorly ventilated, crowded space. There are places, if people want to think about risk in the context of how likely am I to encounter someone who has COVID, the things to consider are how many people are you going to be in contact with, and then for how long and in what type of setting. And there is a website that is, I think, something like COVID risk calculator, where you can look at the risk that you might encounter somebody else who has COVID-19 if you're in a gathering of a certain size. So ballpark, here like now in King County, you might back of the envelope calculate that, with a gathering of about 300 people, somebody in there is going to have COVID. So you have 100%, likelihood, let's say, of having someone with COVID in a gathering of about 300 people. This is rough, and these calculations, involve a lot of assumptions about number of cases that are detected versus the number that are reported and so on. But I did my own calculation, and then it turned out to be very similar to the one that this COVID risk calculator also calculated based on our numbers. So that means that, if you're in a group of 30 people, your risk of encountering someone with COVID is about 10%. And so, if that helps people thinking about it in those terms, great. I think people should gather as much information and use as much as they can to make these types of decisions.
Thank you so much.
Thank you. All right, next question is from Mo Hader. Mo, go ahead.
Hi, Dr. Duchin. Thank you so much. Could you elaborate more on who, regardless of vaccination status, who still you recommend keep a mask on? And my second question is, you said this is not over. So what's next? What do we go from here as far as making sure levels don't go up
Yeah,
and we
thank you
have
for
to
the
bring back
question.
restrictions and mandates?
So right now, the requirements, the general requirements that the state had and that the county had and that all of our neighboring counties had, the requirements for masking of the general public in indoor spaces have been lifted. There are requirements still around, primarily around healthcare settings. Healthcare workers, including medical and dental, should still be masking, and there will be some requirements, recommendations coming out that I believe will entail requirements in places like correctional facilities and homeless shelters, at least recommendations strongly encouraging masking in congregate settings where people are in close proximity. But for the vast majority of settings outside of healthcare and correctional, and then some workplaces, which is dictated by L&I based on what's happening in the workplaces, and under workplaces are included healthcare facilities. Most places would not have any requirements for masking at this point. And then, I will talk a little bit more about that preparedness in a sec.
I'll thank you for answering that. I meant to ask, what I meant is who specifically, if they're high risk or if they're a certain age, regardless of vaccination status, even though the mandate lifted, who should still keep their vote? Specifically, who?
Well, I think this is really what's now up to individuals to decide. I mean, I think the people who really should, are at highest risk are those who are immunocompromised, people who aren't vaccinated, can't be vaccinated, older adults, and then, people who have other underlying health conditions that might place them at risk for severe disease. Those people have, a different risk-benefit calculation than people who are young and healthy. And in that context, people need to think about when they are trying to decide whether they want to mask or not, what's the activity that they're talking about? What will they be doing? What's the risk in that setting? I think everyone, should be thinking about the fact that COVID-19 is not gone. It's still around, and make a conscious decision about whether you're accepting the risk or if you don't want to accept the risk of being unmasked, then you have the choice to mask. But I think the key is to think about it. Think about your situation, think about your health, your exposure to others, the risk of the setting that you'll be in, and then just make a conscious decision about, whether you accept that risk, you're comfortable with it. And if not, masks provide, I shouldn't just say masks, not all masks are equal. I really would prefer that people, if they're going to take that level of protection, use a high quality, well-fitting respirator mask, like an N95 or a KN95 or a KF94 that fits well, doesn't leak, and offers the protection that people are wanting from a mask.
Thank you.
Great, thank you. Now I want to take a question from community watching on Facebook Live. Folks are curious what we know about the BA2 COVID variant, and particularly if you have any projections for King County or Washington State in terms of BA2 after watching that variant increase in the UK.
Mm-hmm. Okay, so Omicron and other variants are made up of groups of genetically related viruses called sublineages, and BA2 is a sublineage of Omicron. It's got a more common sister sublineage, BA1. That's the one that's most prevalent. But BA2 has about 40 mutations that distinguish it from its sister BA1, and has spread rapidly in some areas, become predominant in some countries, and has been detected, in numerous countries and U.S. states. So far, as far as we know, BA2 is spreading more effectively than BA1. That doesn't mean it's becoming more prevalent, but it does spread from person to person more easily. but it doesn't appear to cause more severe illness. It does appear to be covered by our current vaccines. When boosted, our current vaccines protect well against BA1 and BA2. At this point, BA2 remains limited in the US and locally to the extent that we know. I haven't seen a recent report from Washington State Department of Health, so you might check in with them on the prevalence of BA2. But as far as we know, from the last update and from our colleagues at the University of Washington, the proportion of BA2 remains low. And so we can't really predict. In some countries, it's become predominant. It may be prolonging the Omicron surge to a little bit in some places. In other places, it doesn't have a discernible effect on the outbreak. And at this point, we don't see a surge due to BA2 locally, and I'm not aware of any surge in BA2 activity in the US that's causing an outbreak that would be above and beyond what BA1 was doing. But that doesn't mean it's not possible. And for example, if BA2 becomes more prevalent, even though most of us may have protection through vaccination, the level of protection from Omicron BA1 infection alone is uncertain. It's probably reasonable for a while. But for those people who are unvaccinated, I think Omicron is quite likely to find you, period. BA2 is going to be even more likely to find you than BA1 at some point. So as long as COVID remains prevalent, it will remain a potential threat. But as the COVID numbers in general drop, the risk from BA2 and any variant, also is low. If we have an increasing outbreak again, then if BA2 became prevalent, that would be problematic for people, especially unvaccinated. But right now, all the numbers are going down despite the fact that we have BA2 present. So that's very reassuring. And, even if you look at the old CDC classification, where people, said, well, we used to be in high and now we're in low. In the old classification, we're actually sort of in the substantial. We're not in the high any longer, and we're heading towards moderate in the old classification. So things are, our numbers are very good, and I'm not concerned right now about a BA2 outbreak here locally. I think it's a potential. We need to continue to keep our eye on it, but so far there's no signs of that happening.
Thank you so much. That wraps up questions. So Dr. Duchin, I'll hand it to you for any closing remarks.
That sounds great. Well, again, I want to thank everyone for joining today. King County is emerging from the Omicron surge, and our situation is improving every day. Cases, hospitalizations, and deaths are continuing to fall. And if we're lucky, the arrival of warmer weather and more outdoor activity may further limit COVID spread. Our vaccines with boosters are providing a high level of protection against serious illness for most King County residents. Testing is widely available and access to treatment is improving. Our hospitals and healthcare providers are recovering and better able to take care of all of our health needs, even as they address a large backlog of deferred care from recent surges. And while we celebrate this progress today, it's critical to understand that COVID-19 remains with us, both in the US and globally. It's causing major outbreaks in other countries as we speak, and the emergence of new variants and future surges locally are real possibilities. High levels of vaccination with boosters, plus immunity from recent Omicron infection in the population should protect us from another major surge coming soon. And we need to use the time we have now while COVID is not surging to build COVID preparedness and resilience. And this means, for example, not relying only on individuals to do the right thing, but making system-wide efforts to ensure ongoing high levels of vaccination, including the critical booster dose, improving indoor air quality in our businesses, workplaces, and other public spaces, providing ongoing access to testing and increasing availability of treatments, providing sick leave for workers, ensuring access to high quality respirators when masking is necessary, and ensuring capacity in our healthcare and public health systems. We also need to have a much better understanding of long COVID and how to treat it. And finally, we won't be secure locally until we control COVID-19 globally. Now, I hope the worst days of the pandemic are behind us, but unlike the Sonics and Russell Wilson, COVID-19 is not going away, and we will need to grapple with it for the foreseeable future. Although much uncertainty remains, I'm optimistic that if we continue to take the necessary steps and don't take our eye off the ball, over time, we'll continue to decrease the damage this virus will do and its impact on our lives. So thank you again for joining us. I look forward to talking with you again.